Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the lower jaw. The area of interest highlighted is the lower left quadrant for implant placement. This is the panoramic view. We've got um, almost relatively sufficient bone between the ridge to the inferior alveolar nerve. Taking you to the transaxial view, this is the transaxial view. Here we can see the premolar region. We've got approximately D1 quality of bone. In the molar region, the bone quality slightly decreases to D2, and in the second molar region, the bone quality comes down to D2 and D3 as the cortical plate in the lingual gets very thin and the cancellous bone increases and becomes more radiolucent. Now, our kind doctor has requested for us to place implants in this region, so we will place three implants. We do not have the same brand, but we've placed a Korean implant which has relatively the same sizing systems. This is the first implant, the second implant, and the third implant. As you can see, we've tried to place the implants not just center of the ridge, but the area which has the maximum bone support as well as which can be prosthetically restored nicely as well. So moving to the transaxial view for our kind doctor so that they can have a look at the implants that are placed. There we go. So these are the three implants, the premolar, the molar, and the second molar. The premolar implant, we can show you right here. So this is the premolar implant. It has good bone support on both sides. Moving to the molar implant, we've placed a slightly shorter. This is a 7.5 to 8 millimeter implant because the ridge height between this and the inferior alveolar nerve is slightly shorter. We have placed it slightly lingually so that there's good bone support 360 degrees and can be restored. And this is the second molar implant. This implant has to be placed very carefully because the ridge configuration and anatomy is slightly confusing, as well as the fact that there is a lingual fossa present here. So the implant, even if it is placed in this region, can be prosthetically restored and will have absolutely no problems in implant placement in terms of bone support. So if you have any further questions regarding this case, this is the axial view where you can see all three implants are placed relatively center of the ridge. We would also like to highlight that there is a periapical radiolucency associated with the teeth anteriorly, and there is periodontal disease. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.